everyone. Welcome to Free Advice Friday. I'm here with Dr. Murphy. And what we do on Free Advice Friday is this: I ask him a question, then we just chat about it. Sometimes it's advice, sometimes it's not. So that's what the show's called. We can't change it now. Okay, are you ready for your first question?
I am.
Okay, so your first question today, well, this is going to be your only question. We want to know about contact tracing and HIPAA. So contact tracing is nothing new necessarily, but as we've seen with coronavirus, maybe you can explain kind of what contact tracing means. How about that? You explain what it means and then how it pertains to HIPAA. I'll just leave it on you this time.
Okay, this is vague.
Okay,
and everybody interprets these HIPAA rules differently. So contact tracing is if you're exposed to something like, we won't use coronavirus because I'm not sick.
STD.
Well, let's use something a little bit different. Let's use hepatitis A.
Okay.
Because hepatitis A is, it's relatively easily spread. It's a virus. People don't really die of it anymore. And there's vaccines for it, so you don't see it much. However, if you're working at a restaurant, you have hepatitis A, you can spread it to a lot of people. So that's contact tracing. They want to know who the people were at the restaurant that might have potentially been exposed to it, so they get a prophylaxis vaccine to keep them from coming down with this particular disease. And the same applies to coronavirus, meningitis, a host of other diseases, HIV. I mean, they would like to know who the contacts are. Here's where it gets a little bit sticky because HIPAA comes into play here. And this is about privacy. This is about your own personal medical information that you really don't want exposed to the public. Not a lot of it's going to do a whole lot if it is exposed, but it's an embarrassment and stuff. And people just don't want their information out there. I don't.
Yeah.
Pretty sure Michelle here doesn't.
Yeah.
So it has to be kept very private. And there's rules with HIPAA to where it says you can and cannot share with different entities. And the government has a lot of exceptions to the rules to where you can pretty much share anything you want with them, and because they don't care because they're the government. But
they get to know everything about us.
They do. But at the same time, even my employees here can't go through my patient's charts to find out who had what, when, where, why. That is an invasion of privacy. And people that work at hospitals have been terminated because they have done this, where they'll go in
access
and
records,
snoop records, stalk, whatever you want to call it, and just to find out just some juicy bit of information like it's available on the internet, and it's not, and that's a violation. That's not only an offense that's fireable, you can go to jail and be fined for it. So it's a serious ordeal. But then other things come into play too, to where if you're an entity that accepts government money like Medicare, Medicaid, which we don't, so there's a different set of rules for HIPAA because we're not a government entity. But if you're a hospital or a VA or something like that, the rules are a lot more strict. But here they're a lot more relaxed, but I still follow the real strict guidelines. My employees are not going to snoop in charts, and I'm real cautious about it, and they've all been warned. You're not going to discuss anything in this clinic outside this clinic about any employee. I don't even want you to say who we've seen and who we have not seen. So I'm really a stickler, and it's not so much about HIPAA as much to me as it is about decency and privacy. So we tend to be very private, and I take it a step further because a lot of entities have electronic medical records, which you have to have security barriers so people can't access them. Well, I'm a disbeliever in electronic medical records. I think there's people out there that are smarter than I am, so I have paper records, and the only way you're going to get your medical information is to come on in here and get on a copy machine, because other than that, you ain't getting it. So that's pretty much what contact tracing is. They trace who's been exposed to it, but there's some privacy issues that go along with it.
How do they do it with coronavirus? So they basically just say you've been in contact with a person?
Yeah, they want to know the list of names and the people you've been exposed to, and it's just for tracing, looking for hot spots so they know where to pool the resources and stuff like that. So I think that's some good information. And, being exposed to coronavirus is a little bit different than being exposed to HIV and, chlamydia, gonorrhea, and some other things. Yeah. So those things are a little bit more personal, but coronavirus, hell, that's just like the flu anymore, so that's kind of where we're at with that. And I'm okay with that.
Yeah. Okay. So ultimately, your private information won't be given out to someone if you had coronavirus and then
But it has
came
to be
into
given
contact
it
with
has to
somebody.
be given to a government agency. I just can't.
Yeah.
I'm not going to be the one that's going to call people on the phone and say, "Oh, don't you know
would
Susie
be like the health
Susie Q was
department.
here and she got exposed, and oh, by the way, you're all exposed."
Yeah, it's like the health department,
Yes.
essentially.
Yes.
So if you're tested for coronavirus, and tell me if I'm wrong, most testing entities, they're and I think all will get your information. They attach it to your social security number, and then that information is given to the health department.
Yes. And so if you're at a restaurant and there was a person that came up positive at a restaurant, they can call that restaurant and say, "Hey, do you know who was there and what times and for the possible exposures?"
Okay, so nobody's going to say this person's name, blah,
No,
blah, blah.
no.
If they do, they're breaking rules and you have rights. So just keep that in
You have
mind.
rights, but they're not enforceable. They're not going to do anything about it. I mean, all right, so you put up a sign on Rangeland that says Susie Q had coronavirus on this particular day while eating at this particular restaurant. Nobody's going to do anything about it.
Yeah.
So it's a law that can be broken. Yeah, there can be a fine. I don't think you're going to go to
Nobody's
prison.
going to get all wound up about it. But you do
no harm's going to be done.
have privacy.
Yes.
And there
I
are
think that should be taken
some
very seriously.
offenses that are taking. I mean, they take this stuff seriously. So
I do.
if we do, and if there's something, if you feel like your rights have been violated, contact an attorney because.
Or just look up HIPAA, and it's confusing when you read about it.
Yeah.
Because certain rules apply to different entities, so it's not the same across the board.
Alrighty. Well, that's pretty much everything then, huh?
Mm-hmm. Not sure.
Well, thank you. By the way, we do medical marijuana certification exams, and it's Thursday when we're filming this, so that's what this shirt's about. Judge me, I guess. You already do, don't you? No, I'm just kidding.
Yeah, I do. I can judge you.
That's all right. Everybody can. I can't control any of it. So, anyway. But I'll trace who told who what. Anyway, okay. Well, that's pretty much everything. If you have any questions about this, let us know. Otherwise, like and share this video if you liked it. Otherwise,
don't share it.
See ya Monday. For Mythbuster Monday.